Hello and welcome to the Policy and Environment SIG for the ISBNPA meeting. We are very excited to have Dr. Beth Racine in presenting for us today. She is the co-chair of the Policy and Environment SIG, so we're very excited to have her on board presenting WIC in discount variety store and preliminary findings. Dr. Racine is interested in understanding the incentives and barriers to healthy eating and physical activity among different populations in the Charlotte region in the United States and in other countries. Her research is focused on the evaluation of nutrition and physical activity policies and programs. Locally, she has evaluated a number of programs such as Latino Food and Fun Program, Achieve 225, a purposeful play intervention in Charlotte-Mecklenburg schools, and Building Healthy Lifestyles in All Directions, a nutrition and physical activity intervention in Hatteras County Child Care Centers. Nationally, Dr. Racine has evaluated the impact of food assistance programs on diet quality and food security. She has evaluated elements of the WIC program, the Farmers Market Nutrition Program, and the Supplemental Nutrition Assistance Program, and also SOS, a home-delivered feeding program similar to Meals on Wheels. Internationally, Dr. Racine partners with colleagues in India to study the impact of economic development on food security, infant feeding practices, and obesity. Please help me welcome Dr. Beth Racine. Thank you so much for speaking with our group today.
Thanks, Elizabeth. I guess before I get started with the webinar, let me just give you a couple housekeeping items. One is if you have questions throughout the presentation, if you could type them in, I can't see it, but I believe there's a chat box that you should be able to see somewhere to type in what your questions are going to be. Is that right, Elizabeth?
Sorry, yes, there is a line at the very bottom of the screen. If you put your cursor toward the bottom, you'll see a Q&A, and also you'll see a chat box. And for either, if you click on them, please at any time during Dr. Racine's presentation, please enter any questions, comments, and discussion points that you'd like to have, again, either in the Q&A or in the chat box.
Okay, great. So I'm going to go ahead and start with the presentation then. All right, everybody. I'm not sure how many are joining us from the United States and how many are joining us internationally, but before we get too far down the road, I want to tell you about WIC. WIC is a United States Nutrition Assistance Program that stands for the Special Nutrition Assistance Program for Women, Infants, and Children. And I might not have gotten that exactly right, but it's pretty close. We always call it WIC. It stands for Women, Infant, and Children. And it's basically a program for pregnant women and their babies up to age 5. And it's very prescriptive. So it provides a woman, if she's pregnant, she goes into a WIC clinic and she gets her height and weight done. She gets a little bit of blood work done. And if she's found to be at nutritional risk and low income, she may qualify for the WIC program, and it gives the mom vouchers or an electronic benefit transfer card for very specific foods. So these might be a gallon of milk, a pound of cheese, you know, a 34-ounce box of cereal. It's very, very specific around what is what a woman or her children can purchase with her WIC benefits. The driving force for WIC authorization or for WIC participation in the United States is the formula that it provides to infants between 0 and 12 months old. In fact, over half of the infants that are born in the United States participate in the WIC program. So while it's not our largest food assistance program in the United States, it's still a major program. I think the funding for this program is about $6 to $8 billion a year. So what I'm going to talk about today is a discount variety store that has decided to become WIC authorized, meaning that they've decided that they are going to start accepting WIC benefits. So why don't we go to the next slide? Okay, so what's the issue? So WIC participants are low income by definition, so they tend to live in low income areas. And what we're finding in the United States, and you all might be finding around the world as well, is that grocery stores, what we call full service grocery stores that have a fresh produce section, a fresh meat section, a bakery, you know, the whole big store, those tend to be closing up in low income areas because they're financially just not feasible anymore in low income areas. So they tend to be pulling out of low income areas and operating primarily in middle income and higher income areas. So what happens if you have signed up for the WIC program, you can use it at a WIC approved grocery store. But if your WIC approved grocery store is, you know, quite a ways away, that might be a challenge for you to get there. So one thing that I've noticed in some of my other research is in these low income areas, there are a number of food stores. They're just not what we would consider full service grocery stores. So they are like convenience stores, what we call dollar stores, pharmacies. Basically, if you think of a grocery store in the United States, we always say that if you're going to go on a diet, to always eat at the perimeter of the store, meaning focus on purchasing fresh fruits and vegetables, fresh meats, fresh dairy, and to avoid the foods that are in the middle aisles, because that's where primarily all the produce, I'm sorry, not produce, but all of the processed foods tend to be. So a lot of these smaller stores that are found in the low income areas are almost all just those middle aisles. They don't have the perimeter sorts of food items. So no fresh fruits and vegetables, no fresh meats. So there's a chain of these stores that operate in low income areas that we've been able to partner with for the last couple years, and we're calling the chain discount variety store chain. And we've been working with them for a few years to try to think about ways to improve the health of the foods that they sell. Because when you walk into these types of stores, you'll notice that there's a lot of soda, a lot of candy, a lot of chips, that sort of stuff. So when we were brainstorming ideas of what they might want to try, we encouraged them to test out WIC authorization. Because to become WIC authorized, you have to kind of up your game when it comes to your inventory of food. You have to add some healthier foods to be able to meet the WIC minimum food package standard. So that's what we did. Once they started to test out WIC, they decided to do it as a trial basis, a pilot study. We were able to get some funding from the Robert Wood Johnson Foundation, a program called Policy for Action here in the United States, to fund this project. So our goal is, we're hoping that if we have discount variety stores that are located in food deserts, which are low income areas with low access to healthy food, plus the WIC program, that is going to lead to greater healthy food availability in food deserts. So we have kind of a natural experiment intervention. So we have this chain of discount variety stores. They operate thousands of these discount variety stores throughout the country. So they decided to pilot WIC authorization in 10 stores. And then we matched that to 10 of their stores that decided not to implement WIC. And when they first were thinking about becoming WIC authorized, they did an inventory of what they needed to become WIC authorized. And they found out that they already had in stock 58 of the food items that they needed. So these are like Cheerios cereal or a gallon of low-fat milk, that sort of stuff. But to become WIC authorized, they had to add 18 food and beverage items. So our main research question is to see how whether WIC authorization affected the sale of their foods, their WIC eligible foods and their non-WIC eligible foods. So this slide shows us kind of what we are looking at for our comparisons. So in this table, you see dollar sales. That is showing you for stores on average, they were selling about $9,000 worth of food a week, and we looked at the top non-WIC foods that were being sold. So these are like, oh, I see a colleague of mine on my video. The top 50 non-WIC foods, like chips and bread, white bread, and that sort of thing. About $1,100 per week is spent on those types of items, and then on the WIC types of items. So again, like cereal, cans of green beans, milk, kind of healthier WIC-approved foods, they were spending about $376 a week. And then we have the unit sales for those also. And we can see over in the text that the non-WIC foods it consists of about 12% of their average sales, and the WIC foods consist of about 4% of their weekly sales. Okay, so how do these foods differ? The WIC eligible foods, so this is the 58 are the 58 or so WIC foods that they already had in stock. This is how they compare nutritionally compared to the top non-WIC foods that are currently being sold. So you can see that there's a difference in the nutritional value of these. You can see it on a number of levels, but this slide just kind of highlights the saturated fat and the sugars. So clearly the WIC eligible foods are healthier than the ones that the people coming into the store are purchasing. All right, this slide shows us what people are using, what tender are people using to purchase their WIC and non-WIC foods. So when you go into this store, you can use cash, you can use a credit card, you can use your WIC benefits. You could also use your SNAP benefits. And SNAP is the largest food assistance program in the United States. It stands for the Supplemental Nutrition Assistance Program. And this program is quite different from WIC. It's about a $80 billion a year program. And with this program, you get basically a debit card, and each month it's populated with cash that you can use on any kind of food at any SNAP authorized store. And there's many more food stores in the United States that are SNAP authorized as opposed to WIC authorized, because with WIC, it's much more, as I mentioned before, prescriptive, where the inventory at the store has to be at a much higher bar than for SNAP. For SNAP, they also have regulations about what foods have to be offered, but the bar is much lower than it is for SNAP. So on this slide, you can see that, let's see here. So for the WIC pilot stores, so there were 10 WIC pilot stores. The blue bar is the sales that we're seeing with cash or credit for those top 50 non-WIC foods. And the blue, this lighter blue, is the sales that we're seeing for the WIC type foods. So again, green beans, milk, cereal, that sort of stuff. So on here, we wanted to see if people that are participating in the SNAP program, which are also low income, in fact, this population is typically even lower income than the WIC population. If this population, what they're using their SNAP benefits for. So we can see that they're using a decent amount of their SNAP benefits on those common WIC non-foods, but they're also using some of their SNAP benefits for the WIC type foods. And this slide right here, this is the before slide. So there shouldn't be any purchases with WIC dollars, and there aren't. And if you go over to the after, this is after WIC's been implemented. you can see that there's some sales in the WIC category. So one thing that I didn't mention before that I need to mention is that we have 19 months worth of sales data for 20 stores. So we have about 10 months, or I think it's 11 months of sales data for the time period before the discount variety store became WIC authorized. And then we have about 9 months of data for when, during the time when it was WIC authorized. So the before represents those 11 months prior to WIC implementation, and then the after is the 9 or 10 months after WIC implementation. And then we also show the control stores here just so you can get a sense of how the sales kind of compare from the pilot stores to the control stores. And you can see there's really not much difference going on here. All right, so this kind of describes what I was talking about before, that we have 11 months of pre-WIC data, and then we actually have 8 months of WIC data once it became WIC authorized. And these are the main things that we're looking at: the sales of the WIC outcomes and the top 10 or the top 50 non-WIC sales. So this slide just gives you an idea of what are the top sellers when it comes to the WIC eligible items and the top 50 selling non-WIC items. So the top sellers are milk by far, I believe, whole grain cereal, 100% fruit juice, eggs, and canned fruits and vegetables. And then the top 50 selling non-WIC items are the leader in the pack is white bread. Then we have salty snacks, soda, candy, and packaged baked goods. So this slide is showing us the trends in sales over time. So this pink bar here is when WIC was implemented. So everything over on the left side of the graph are the sales prior to WIC implementation, and then on the right are sales post-WIC implementation. So this red line are the sales for the non-WIC foods, those top non-WIC foods that we were talking about on the last slide. And then the green line are for what we call the status quo WIC items, so the WIC items that were always there. So again, this shows that there's quite a bit more sales in the non-WIC foods versus the WIC foods. But then we can see a tiny bit of a trend that shows that the unit sales for these things are inching up just a tiny bit. This is for unit sales, and this one down here is for the actual dollar sales. You can see it clearer for the dollar sales. And here, this blue line, these are for the new WIC items that they had to add. So as I mentioned before, there were 18 items that they had to add. One of the items that they had to add was infant formula. Now, I don't know if you've ever purchased infant formula before or if you know much about infant formula, but infant formula, at least in the United States, is incredibly expensive. That's one of the things that draws low-income women to apply to the WIC program, because they can get infant formula for free. And while you can tell on this slide that the number of items purchased are very, very low, I mean, you can just see that it's slightly over 0, that the sales are actually quite large, probably around $1,500 per store per week, I think that is. So while the units say you don't have to sell many cans of formula to start making a profit. So what we're looking at right here is the regression analysis. We wanted to be able to see what were the factors that influenced the sales of the WIC items and then the non-WIC items. So let's look at this model first. So we have for the WIC items, so again, canned green beans, milk, cereal, relatively healthy stuff. We have factors that influence the number of products that were sold, and then we have the dollar sales, the amount of those items that were sold. And this shows that our what we hypothesized, which was if we added WIC to the, if a store became WIC authorized, would it drive the sales of these healthier foods? We show that it does. It increased the sales for stores on average by about $69, and the number of units sold by about 29 units. But the other thing to me that's interesting is that it also shows that there was an increase in sales of healthy food as the number of minority residents in a community increased, and as the number of households that participate in SNAP actually decreased, and if the number of households with no car increased, that also led to an increase in the number of healthy foods sold. So this result here, the number of households with no vehicle, that I think is important for our field, because it kind of, it really does a nice job of showing us that if you have low-income folks who live in an area and they don't have reliable transportation, they're more likely to go buy their groceries at these smaller stores. And that's one thing that we've always kind of hypothesized in our field, but there hasn't been that much research to show that it's actually happening. And that's one thing that we're seeing in this data. And then when you look at the top 50 non-WIC items, you can see that WIC really didn't really impact the sales of the non-WIC items. But we can see that if the number of minority residents in the community increased, that did increase the sales. So this slide just kind of summarizes the findings, that WIC implementation did lead to an increase in sales for what we would consider the healthier WIC-approved foods, and that having more households with no vehicle access was related to WIC eligibility, or to the purchase of WIC foods. But there was no evidence that WIC implementation significantly affected the sales of the non-WIC foods. All right, right now, before we go on to the qualitative findings, I just wanted to mention something about another quantitative analyses that we're doing. So we're still in the middle of this study. We're still analyzing data. And one of the other analyses that we're doing is we're looking at whether having a store become WIC authorized influenced the sales of other items in the store. Specifically, I think that if you're going to provide this program, that it really appeals to moms with small children, that when the moms with small children are in the store, they probably are going to be more likely to purchase other baby-related items while they are there. So diapers, wipes, bottles, that sort of thing. And the reason that we're looking at this is for a couple reasons. One, we think it's just interesting since we have the sales data. It gives us a unique opportunity to do this. But the other reason is if we think that having these smaller stores become WIC authorized is good for WIC participants, then it has to be good for the corporation. If they don't see that they're making money by becoming WIC authorized, they are not going to stay WIC authorized, and they are not going to jump through all the regulatory hoops to become and maintain WIC authorization. So if we can find some sort of financial benefit for them, then it might help the WIC participant. So now on to the qualitative work. So in addition to having the sales data, we also did a number of interviews with the corporate staff and staff at the store level. So we did in total 30 interviews, 6 with corporate staff. So these are staff members of this discount variety store chain that were involved in some way in the WIC authorization process. So they may have been the person that had to, or that was the liaison with the WIC state agency to figure out exactly what foods they needed to have stocked to become WIC authorized. It may have been the corporate worker who set up the computer system to be able to have their registers recognize WIC authorized foods. It may have been the financial person who was able to kind of collect all of the WIC vouchers, because where these stores were, the WIC benefit was in the style of a check, and make sure that those got sent over to the WIC state agency headquarters for processing. So we interviewed 6 corporate staff, and then we interviewed a number of people who were in the stores themselves. So these were cashiers, in-store assistant managers, regular managers, etc. And the objective of the qualitative research is to identify the barriers and facilitators to becoming a WIC authorized vendor. And we used in vivo software and coded the interviews and used an inductive approach. So I'm not going to spend a lot of time talking about the qualitative findings. I'll just share these kind of basic results. So one thing, and I don't know if it was on one of these slides or not. If not, I'm going to talk about it right now. In the United States, participation in the WIC program is decreasing. So there are, let's say there's 100 women in a certain town that are eligible to participate in WIC. Well, maybe only about 70% are actually participating. So the WIC program is seeing a decline in participation. One of the reasons that that's been documented that they're seeing a decline is because WIC participants are reporting that they're having trouble using their benefits. So we're hoping that if this pilot works out for the corporation, for the WIC participant, that it will also help the WIC state agency and the USDA, which is the part of the US government that oversees WIC, help them with their enrollment numbers. So that if it makes it easier for women to use their vouchers, then hopefully they will not only enroll in the WIC program, but stay in the WIC program longer. And another reason that we know that people tend to drop off of the WIC program is they find sometimes that it's a hassle to use their benefits in the grocery store. So if we compare it to the SNAP program, the one that I said is the bigger food assistance program, and you can buy anything with it on a credit card-like device, it's very easy when you go to the checkout counter at the store to use your SNAP benefits, because as long as it's food, it's going to go through the checkout line just fine. As opposed to WIC, which is again very prescriptive. So if you come to the checkout line to redeem your benefits, and if you have a box of cereal that's not exactly the right size, or if you have a jar of peanut butter that's not the right brand, or if you have a type of milk that doesn't have the right amount of fat in it, you might be sent back. And the cashier might say, well, sorry, that's not WIC approved. You need to go back and find something else. So those hassles of actually redeeming your benefits with WIC are another barrier to women signing up for WIC and then staying on WIC. Okay, so back to the barriers and facilitators experienced by the discount variety store chain when they implemented WIC. So a barrier that they reported was that there was limited choice in store products for customers. So this is what the cashiers were telling us. So if you're a woman who's on WIC and you can buy, let's say the WIC state office, which signs you up for WIC, says that you can purchase up to 30 different kinds of cereal. If you go to a huge grocery store, like a Walmart or just a regular traditional big grocery store, you can buy a number, most of those grocery stores or most of those brands of cereal are going to be at those big stores. At a small store like DVS, they might only have 1 or 2 varieties. So that was the limited choice in store products was one thing that the cashiers said that the WIC moms were complaining about. Another thing that was a barrier expressed by, that the cashiers told us, was that the complicated or unclear labeling of WIC eligible products in the store aisles was a problem for the WIC moms. The store also told us that they had, in some cases, had difficulty training store employees how to process the WIC payments. But then there were some facilitators. So one thing that we learned was the people that worked at the cashiers, who were the cashiers, had a lot of experience with the WIC program because either they had been on the WIC program before or they knew somebody that had been on WIC, so they were quite familiar with how the program worked. And that really helped the corporation because it made it so that they didn't have to train them quite as much because they already knew how WIC worked. The store staff also said that a lot of their customers were very excited that their store had become WIC authorized, and the fact that it was so close to where they lived was an important factor for them. So this is, I believe this is my last slide. So the conclusion is that WIC implementation was associated with increased sales of healthier WIC eligible foods, that WIC authorization is a promising intervention to increase availability of healthier foods and food deserts. And one of the reasons that we only have 8 months worth of data currently for the post-WIC implementation is because for the pilot stores, the WIC program decided to change from a voucher system, like a paper check, to an electronic system. And the corporation didn't have the technology in place to affect that. But if the discount variety store decides to adopt the electronic benefit system WIC program, then we think that it's going to take care of a number of the barriers to processing WIC checks that we saw at the store level. So I want to acknowledge all of our research team. So I am at the University of North Carolina at Charlotte, and one of my colleagues, Katelin Hudak, is on the line with us. She's actually has done a lot of the data analysis and writing up so far for the quantitative results, and she also did a couple of the interviews. My co-PI is Elizabeth Mumford, and she's at NORC at the University of Chicago. But thank you for listening, and let me know if you have any questions.
Thank you so much for an excellent presentation, Beth. We have several questions that have come in, many from Urenje. Thank you for that. I think some of them have likely been answered through some of the responses that you've already provided. But the first question, did you say that the program contains formula feeding for babies?
It provides formula. It also promotes breastfeeding. So it basically says to the mom, it provides nutrition education while the mom is pregnant and once the mom has had the child. And it tries to promote breastfeeding quite a bit, but it also makes formula available. And it actually, the WIC program is the largest purchaser of infant formula in the world.
Super. I think you've also probably addressed some of this even with your results, but it's still a very important question. What is the advantage for stores to become WIC authorized?
Well, in this case, we're thinking that the advantage is a few. One is to increase their sales, because this particular type of store sells things at quite a small amount of money. I think that their average checkout kind of basket is about $3 to $4, $5 for the typical person who comes up and buys something at the cash register. Well, if the person is then using a WIC voucher, they're going to increase that transaction to about $50 because of the value of the WIC foods, especially the formula. So that was one reason, right? Another reason is to serve their community. If they want to build brand loyalty or to their store, if they provide this, basically this service of becoming WIC authorized, that will hopefully build community support for the store in general.
Sorry to interrupt. If I may jump in, one beauty of analyzing the sales is we would like to see not only the sales of the WIC eligible items increase, but also, as Dr. Singh mentioned, in other analyses, we're beginning to look at other items. So we're thinking that if WIC draws more people into the stores, or maybe more often as people come to pick up the formula or some other basic food items, that they are getting not only the food items, but also the baby items, the diapers and the baby wipes. And also not that we want to see some of the top 50 non-WIC foods increase, because we can see by their nutritional profile that they are less than healthy, but just sales of other things in general. So if there's a financial incentive for these stores, then we see that as a win-win, because their sales increase and people in the surrounding community that might have limited access to healthier foods all of a sudden have a bit more selection in terms of healthy foods.
Super. Thank you very much, Katelin. A follow-up comment, again, I think a question that you've mostly addressed already, Beth, is infant formula feeding promoted in the United States?
I think that's a very political question. I guess that's why I was given that question. The WIC program would not say, and I don't represent WIC. I don't work for WIC. I used to work for WIC, and I used to work for the USDA, well, as an intern. Is it promoted? I think that's a matter of opinion and a matter of perspective. We buy a lot of infant formula, that's for sure. But I'll tell you, the whole reason that WIC was started in 1972 was because women, so at that time in the early 1970s, infant formula was the hot new thing. Wealthy women were feeding their babies infant formula, and everybody thought it was wonderful and convenient and yada yada. So what ended up happening was, because low-income women could not afford infant formula, they started making their own. They started taking evaporated milk and adding water to it and feeding their babies with that, basically making their own concoctions. As a result, babies were coming into pediatricians' offices severely anemic. And it was a pediatrician at Johns Hopkins, who was actually one of my professors when I was in my doctoral program, David Page, who said, we can't have these kids becoming so anemic. They were also going into renal failure because they were taking on cow's milk, which babies can't process. So he was the one that had a small pilot program to provide women that wanted it formula, while still promoting breastfeeding for the people that wanted to breastfeed. That's how WIC was born. And it's now become, as I mentioned before, more babies, more than half of the babies born in the United States participate in the WIC program today.
One thing else I'll jump in and add is there's a big difference between the support that's given to postpartum women here in the U.S. compared to many other countries, especially in Europe. So women have a lot shorter time to have off from their jobs. And so breastfeeding does become a lot more difficult. So even if breastfeeding is promoted, a lot of people choose to do the infant formula because it's more convenient, especially for low-income women who might not have the option to just take more time off work when very little support is given to families when babies are born.
Right. I mean, low-income women usually can only take off maybe 3 or 4 weeks before they have to go back to work. So, and we've done qualitative interviews with low-income women trying to breastfeed, and very few will make it to 3 months or 6 months because of the job pressures to go back to work.
Thank you both. The next is a series of questions. I'll read them all and then we can take one by one if you'd like. I'm wondering whether the best approach to expand food assistance programs is to ask food retailers to be authorized for both SNAP and WIC. Would it not be easier to combine both programs so that more food retailers would be able to offer them? Additional questions include, did store owners agree that there was an increase in WIC eligible foods? Was this significant to them? And did they experience a decrease in sales of non-WIC foods? And finally, did they mention changes in customer satisfaction? So maybe to take the first bit, the approach to food assistance programs authorizing for retailers to be authorized for both SNAP and WIC, would that be a better approach?
So this is Beth. A lot of stores are both WIC and SNAP approved. So I would say almost all of the major grocery stores are WIC and SNAP approved. All the Walmarts are WIC and SNAP. It's when we get down to these smaller stores that are not traditional full grocery stores that the vast majority of those are SNAP authorized, but not WIC authorized. And that is what we are trying to encourage smaller stores to consider WIC authorization. It's a lot harder to become WIC authorized. So would it be nice if they were both, they had both? Sure, but they do work very differently. So a store has to learn the rules for both. Katelin, do you want to jump in?
Yes, so there are, when we did this, it was just within one state, and there's so many differences across the states in terms of the requirements that each store has to have. So in some states, it's very infeasible for a small format store to become WIC authorized. For example, in DC, there is a really large square footage requirement that each store has to become WIC authorized. Other stores have to have a much larger number of eligible items and a larger number, like a larger variety that they provide. So for some small format stores, just because of the way they're set up, it's very infeasible to become WIC authorized. So it's a great idea, but unless they change the WIC requirements across the states, which is, I mean, in some ways that would make it nice for retailers so that it would be a little bit more streamlined. But unless they change that, it's very infeasible to for small format stores to become authorized everywhere.
Great, thank you. So the next question, did store owners agree that there was an increase in WIC eligible foods, and was this significant to them?
Well, you mean in sales of WIC eligible foods?
Yes.
They can see the same data that we can see. I mean, it's their data that they're sharing with us. So they're looking at the data as closely as we are, although they don't have some of the statistical kind of expertise that we do. So as I mentioned, these results are preliminary. We're not done. So we haven't actually shared these results with the chain yet.
So a technical question, did they experience a decrease in sales of non-WIC foods?
No.
Okay, and at this point, this is the last question. So others, please chime in if you have additional comments or questions that you'd like to ask Beth. and Katelin. Did they mention, the store owners, did they mention changes in customer satisfaction?
Yes. And I'll let Katelin explain because she participated in the more of the qualitative analyses, coding the interviews, etc.
Yes, so I'm not sure if the like the DVS corporate received much feedback so far. And again, we are preparing a white paper and results to share with them so that they have some of the same information that we do in terms of the customers' feedback. But just listening to the interviews and reading them, many people were very excited to have the WIC program, to have it in stores, because it was, I mean, it is so convenient. A lot of times it's just right in their community, and they can have kind of a one-stop shop to get the basics that they might go to the DVS for anyway, but then that they are able to pick up these higher end items, which sometimes the formula is very heavy, and if people are on foot, if you have to use a bus or something, another form of transportation to get to the larger stores, just having one of these DVS stores authorized in your neighborhood is very convenient to just pick up this formula and other items and walk back to your home. So I'm not sure if the corporate staff do know yet about that positive feedback, but again, we'll share that with them.
Super. I'm waiting here for a moment. Yeah, Yurenje responds that it's a great presentation. Thank you so much. Very interesting topic, and would like to hear more about the research. If there are any other questions or discussion points, please use the chat box at this time. Otherwise, I'd like to hear from you, Beth, if you've indicated that a major policy implication for the United States, especially considering that there's such a decrease in participation in WIC. Are there any other policy implications that might be applicable to WIC populations or also other countries in thinking about how policy influences access to healthy foods, especially in food deserts?
Sure. I think that the biggest policy implementation, well, I guess there's a couple. The primary one is that one thing that we've learned, and Katelin has already pretty much described this, is that in the United States for SNAP authorization, the person, if you own a store and you want to become SNAP authorized, you fill out paperwork and you send it right to the federal level. You send it to USDA. They administer the SNAP program. And I don't know all the ins and outs of becoming SNAP authorized, but it's not that difficult. To become WIC authorized is much more onerous for the store. And as Katelin illustrated, there's different rules for every single state. So from the corporate store's perspective, it's a hassle to become WIC authorized and to learn the rules for every different state. So from a policy perspective, that's kind of where we would hope that our research makes an impact, is to kind of be able to show through the research that it would be nice if the USDA at the federal level and the state WIC offices, which have a lot of freedom individually, could get together and come up with a basic package of WIC allowed foods that could cross states. So that if a chain that operates in multiple states wanted to become WIC authorized, they could pick that kind of route. That's the main policy implication that I think our research could help.
Outstanding. Yeah, Katelin, did you have anything else you wanted to add with that?
No, that pretty much sums it up, I think.
Super. I am not seeing any additional questions at this time. Beth and Katelin, thank you so much for such a fantastic presentation for our Policy and Environment SIG of ISBNPA. This was a fantastic way to get us excited to meet again in the Czech Republic and spend some time in Prague talking about this some more. Thank you so much for all of your time. And Antonia, I'll turn it over to you.
No, it's just to thank everyone that was involved at this excellent webinar. So, and we will see you soon. So, bye-bye.
Thank you.
Bye.